In this lecture, we will discuss left leg, right leg lead reversal and how to identify it on the EKG. Making sure that the EKG leads are connected to the correct electrode position is important for getting accurate rhythm strips in 12-lead EKGs. If the leads are reversed, we call this lead reversal. It can often produce EKG abnormalities. It is important to be aware of these accidental misplacements of the limb lead electrodes because they can mimic various pathology, including chamber enlargement and ectopic atrial rhythm, or even myocardial ischemia and infarction. Now, when the limb electrodes, that is the left arm, the right arm, and the left leg, are exchanged without disturbing the neutral electrode, which is the right leg, then Einthoven's triangle is flipped 180 degrees or rotated, resulting in leads that switch positions, become inverted, or remain unchanged, depending on their initial position and vector. Now, that won't be the case here because we'll look at when we disturb also the right leg or that neutral electrode. Remember, the goal here is to be able to see why these EKG changes occur and then be able to reason them out on your own instead of memorizing anything. So we'll also mention a few things from, in this case, that can help us lead us to it. And I think you'll find this one an easy one when we switch these lower limbs, okay? So here we're looking at what happens when the left leg and the right leg electrodes are reversed. In this case, Einthoven's triangle is preserved because the electrical signals from each leg are virtually identical, okay? So if you look here, here's our left leg, which is in this position here, and this is our right leg, our neutral electrode, okay? And we're saying what happens when we switch these two, okay? Well, what happens is now the left leg comes here, and the right leg or neutral electrode comes there, okay? But notice that everything is preserved, okay? Here's our left arm to our left leg. We still have lead 3 going in that direction, okay? The right arm to the left leg, we still have lead 2 in that direction. The right arm and left arm are not touched, so lead 1 will still remain in that position. And the same thing is true for the augmented leads, okay? Leads AVR, AVL, and AVF don't switch places, okay? AVF still now comes to this position, and because the left leg and the right leg, or the neutral electrode, are pretty much the same, the electrical signals from each leg are virtually identical, okay? So because of this, electrical signals being the same, the EKG will essentially also be unchanged. So if you look here, this normal limb leads, okay, and then this is when we have the left leg, the right leg reversal, as you see here. What we have going on is pretty much the same thing. So these are pretty much identical, okay? Lead 1's unchanged, lead 2's unchanged, 3, AVR, AVL, as well as AVF, okay? So pretty easy here. So then how do you spot this sort of lower limb lead reversal or lower limb electrode reversal, okay? Well, you really can't, and more importantly, it won't change your EKG interpretation. So it's really not too difficult, and hopefully that makes sense why nothing's changing. So let's review what we discussed before we end here. So this left leg, right leg reversal, or these lower limb electrode reversals, in this case, we have Einthoven's triangle being preserved, okay? And because it's preserved, we pretty much have all the limb leads remaining the same, okay? So the ones that are unchanged are pretty much all the limb leads. Remember, this does not affect the EKG interpretation, so if this happens, well, I guess it's a mistake, but at the same time, it's not going to affect how we interpret the EKG. Well, that's the end of this lecture. We discussed left leg, right leg lead reversal, and how to identify it on the EKG. I hope you learned something.